Hi, today we are talking about women's pelvic health with Dr. Mendoza, and she is a chiropractor who specializes in pelvic health. And we are going to be talking about everything having to do with pelvic health, actually back pain, pelvic pain, pain with intercourse, incontinence, urgency, retention, pain after delivery. There's a lot of in terms of women's pelvic health. And I think that it's something that we don't always talk about. And I don't think we always see pelvic health as maybe one of the root causes of some of these issues. So Dr. Mendoza is going to be talking about this today. Hi, Dr. Mendoza. How's everything going?
Good. How are you?
Good. I'm glad to have you back and now talking about women's pelvic health. I know last time we were talking about pregnancy and all the pregnancy related issues. And this time we're going to talk about some of the problems that happen after delivery and how that can relate to some pelvic pain, but also just women in general having these issues, right? So where do you want to get started with women's pelvic health? I know it's a lot to talk about here.
Okay, let's go over what happens after having a baby. Because I know a lot of everyone who's on right now, like past patients, friends, and family, they're wanting to know, how can I heal myself after having my babies? And a lot of women are not told what happens, or the process is just come back in for your 6-week checkup, and then you're okay to do whatever you want, which is not always true. So I made a list. Since this is my 3rd time being on now, I was like, okay, let's prep for this one. So
Great.
So after pregnancy, usually what happens is, you're extremely tired, and that's where you come in, right? Because you help to regulate the hormones after giving birth. Because once you give birth, all of the hormones that you're holding with the baby inside is now pushed out, and that's the reason why some women will take supplements, right? And that's just to regulate their hormones. But then physically what happens is you're really tired. You have poor posture from breastfeeding, and you also have some weaknesses in the pelvic floor if you've had a vaginal birth. For women who've had a C-section, then they have a different healing. So we'll go over women who've had vaginal births. After the first pregnancy, a lot of women don't experience too much pain or too much changes in their bodies. But then others will have them, especially if you have a predisposition to lower back pain. You've had it in the past. After pregnancy, it will sometimes make it worse. Not always, but sometimes. And so when you've had a vaginal birth, your pelvic floor muscle, which is the muscle that has to stretch so the baby can come out, that becomes weaker, because think about it, it's a smaller opening, and you have to push a baby's head out of there. So at that one moment, your body has to accommodate for that. And afterwards, people always think that okay, I should be able to go work out, I should be really strong. But what they are starting to notice is that I can't hold my urine anymore, or I have pain during intercourse, or I can't go running anymore. When I go run, I feel like there's something falling out. I hear this more after women who've had their 2nd and 3rd babies. So the first one's not so much, but to prevent if you decide to have a 2nd baby or 3rd baby, and you want to prevent that feeling of not being able to hold your urine and to be able to exercise again, then you want to start strengthening. And the best time to do it is after your first pregnancy, or before, during pregnancy, as we talked about 2 weeks ago. And, before you do any of this stuff, I always suggest everyone to check in with your doctors. Make sure that when you go see your OB or GYN, that you explain to them what you're feeling, because they're not always going to ask you. They're just going in and check to see the stitches are good, and that's it. So you have to tell them, hey, I feel weaker. What can I do? I feel pain here. I'm feeling pubic pain. I can't go to the restroom. I'm very constipated. It could all be related from the pregnancy and after giving birth. And so you want to talk to your doctor, get the okay from them. And if they say, okay, you're fine, the stitches look good, you can start working out again, then you can do the basic stuff on your own. And I do love, I think I've mentioned them before, but belliesinc.com. They switched owners now, but it's still the same product. I love it because when they send you the belly band that helps you to recover and rehab, they also send you a little booklet, and it has eight, yeah, it has like 8 different exercises that we can do, and it's progression. So you start with one exercise and you progress to the second and a third. And in 8 weeks, you should feel a lot stronger, and you're ready to start working out. And with what you learn from that like little booklet, you can use the same technique in any exercise. So if Pilates was like your thing before you got pregnant or during, you want to make sure you rehab, and then you start getting back to Pilates or whatever it is that you did before.
Okay, so it's Belly's Inc. Is there a specific product that they need to look for? Do they only have one product, or?
They only have one product, and it's this belly band that you wear. I think now hospitals are giving them to moms now. It's like it's like a support belt. That's the one from Belly's Inc. Is a lot higher, because what it does is it covers your transverse abdominis, which is what separates when you're pregnant. And so it covers from like the bottom of your xiphoid process, which is underneath your ribs, all the way down to the top of your pubic bone. And that's the reason why I love it so much, because it covers everything. And it's not just like securing one area when you're exercising. And when you wear this, it's only during exercise. And I sometimes have patients wear it when they're breastfeeding, because when you're breastfeeding, you're contracting, right? And so a great way to kind of get your exercise in and do something else for the baby.
So is that right after you give birth, or do you wait till 6 weeks, or when do you start using that?
I would say as soon as you give birth, like even in the hospital, if it's okay, I would still ask the doctor. But the exercises are so simple and easy. It's not going to create any damage. Now, if you have an episiotomy or really bad tears, and you're at like 3rd and 4th degree tears, then I'd wait until the stitches heals first, and then you can do the exercises. And but the belly band, you can wear it, because even if you have stitches, the belly band is supposed to help protect and support that anyways. I'm sorry.
So that makes sense. So you think it's probably good while you're pregnant to buy this in preparation for your postpartum time?
Yes, it takes. Yeah. So I'm sure there's other distributors out there that may be selling the same band, but I always tell my my patients to buy them 2 months in advance, because it's coming from Canada, and so it takes the basic is 2 weeks. Okay. So it may take a lot longer, especially since, we're going through COVID right now, and shipping is like a lot slower.
Okay. Yeah, that's great information. So I think that's so important postnatally, but also what I found, and I think most people find, is like after you have a baby, and you mentioned like after the 2nd or 3rd baby, but I even think after the 1st one, it's harder to hold your urine in. So incontinence, and you can have leakage and things like that. So can you tell us a little bit about that, how to prevent it, and what do you do if that's happening to you?
So if you're having incontinence because of pregnancy, then definitely pelvic floor exercises. I would, if you're not sure if you have a weakness in your pelvic floor and you're not sure why you're, leaking urine, then I would contact a physical therapist or a chiropractor or a medical doctor. Occupational therapist also does this, and midwives. Find out if they do pelvic floor therapy, because it might be something else. There's always other reasons why you may have incontinence. The main one after pregnancy or giving birth is because of the weakness of the pelvic floor muscles. And so what I would start with is just breathing exercises. A lot of us breathe from our chest and not from our diaphragm. So learning how to breathe diaphragmatically, you can look at YouTube videos. I'm going to start putting videos up on my page just to kind of go over each exercise and how to do them. But you want to start with when I took training with Belly's Inc., they call it the core breath. But like all the other trainings that I've used, they use different names for it, but I'm just going to use core breath because that's what I learned first. But core breath is diaphragmatic breathing, where you want to breathe fully and let the oxygen go into your lungs, and then use your diaphragm, and then use that when you're exhaling and breathing out. You want to use the contraction. And so the contraction is basically an activation or an engagement of your pelvic floor muscle. So the pelvic floor muscle is a muscle that you feel when you, like when you have to use a restroom and you have a bowel movement or you have to urinate. It's the same muscle that has to relax to open up the sphincters that allows, you know, the everything to come out, right? So if people aren't aware of what that muscle is, I usually say go to the restroom, and don't do this often because you don't want to stop your pee all the time because that can cause an infection, right? And so you want to just kind of feel what that muscle feels like. So sit on the toilet. When you urinate, you're going to stop your pee. That muscle that you use to stop your pee, or that muscle that you use to stop from having bowel movement, that's the muscle I want you to work on. So when you, so I'll go over kind of like what I teach a patient. I have them sitting on an exercise ball, and when you're sitting on an exercise ball, you want to make sure that it's the same, it's the right height for you, because you want to make sure that your thigh is parallel to the floor. If your thighs are tilting downwards and the ball is too big, and if your thighs are tilting upwards and the ball is too small. So I want to make sure that you get the right size. Most women are like in the medium and small range, unless you're really tall, then you get the larger one. But I have people sitting down on the ball securely with their thighs parallel to the floor, with their feet planted on the floor. And you can start off with putting the ball in the corner. So just in case you lose your balance, you don't, you know, fall and injure yourself. And while you're sitting on the ball, I have people taking deep breaths in and out. Now, if you're not sitting correctly on the ball and your diaphragm and your pelvic floor muscles are not right on top of each other, then it's gonna be very difficult to take a deep breath in. So, you know, later on after this, if anyone has an exercise ball, just practice that. Like put it in a corner, sit down, take a breath in. When you breathe in, you should feel your stomach expand. And that's a diaphragmatic breath. So you feel your stomach expand. So it's going to feel like you have this huge belly, or like for women who've had a baby recently, you're going to feel like you're pregnant again. That's what it looks like. So breathe in, you feel your stomach expand. And when you breathe out, you should feel your stomach sink in. And that's your core activating. So once your deep core muscle activates, you should also try to engage the pelvic floor muscle by pretending, I'm going to use this as a cue, but pretending there's a blueberry that's sitting on top of the exercise ball, and you're trying to pick up that blueberry. So you can think of picking up the blueberry from your vaginal opening or your anal opening, or you can pretend to pick up a blueberry in the middle between those two openings. And since the blueberry, it's very delicate. So if you contract hard, like stopping your pee, then you're going to squish the blueberry, right? So then we don't want to do that yet. We want to make sure that we slowly activate it. So pretend like it's very delicate, that you're going to gently pick it up. And as you're breathing out, you're gently picking up that blueberry and pulling up to the top of your head. And that's what I do the first day. And after that, we're going to use that same cueing, the same technique of picking up the blueberry, and we do it in different positions. And I start from the very basic. Even if someone's like an athlete and they've done, you know, CrossFit games and all the other stuff, or, you know, they're a runner, they run marathons, I always start them from the bottom. So I have them sitting on the ball first, learn how to do the core breaths, and afterwards we start with like basic exercises. For instance, I'm going to read off my list, but I'll go over core breath and proper alignment on the ball. And then we do bridges, clamshells, a sideline bent knee lift, a seated march. A seated march is when you're sitting on the ball. And then doing squats, a standing leg transfer, then lunges. And the reason why, like if you can kind of follow through with like the exercise progression, I do everything on your back first, and then I do it sitting, and then I do it standing, and then I do it going forward, which is the lunge. Because if you can't, you know, balance on a ball, then how am I expecting you to stand up and do an exercise? So I want to make sure that you're strong from laying down to all the way to standing up. So that's like,
so, but even if you don't have a ball, let's say people who don't have a ball, you can still do it kind of in a chair where your legs aren't too high as well. Like it's the right size chair as well too, right? Okay.
Yeah, you can definitely do it on a chair if like you can't get a ball anywhere, because it is harder to get things shipped now. But it's good to do it on an exercise ball because it's forcing you and your core and your brain to balance on it.
Yeah.
And I think we lose that because when we're pregnant, our bellies are so big, right? And so then we lose our equilibrium and our balance. And that's the reason why you see a lot of pregnant women, like they have a really like large arch in their back. Like they're extending their belly really far forward. And it's because your body has to balance that out. And so we lose that. Like after we give birth, we don't have this huge belly in front of us anymore, but we still stand and walk like that. So we have to change the proprioception, and it's good to do it on a ball because you're forced to use your proprioception.
Yeah. And most pregnant women have a ball anyways. So, but yeah, I see that. Yeah. Okay. So that's great. So what if somebody gave birth like years ago and then they have incontinence now? Or let's say a woman hasn't been pregnant and they still have incontinence, which still happens as we age as women as well too. Can you tell me about that and how to prevent? And is it the same thing, or what are things that could be causing this incontinence if you haven't had a baby?
So for younger women, it's from repetitive stress to their bodies, such as like athletes who play basketball, female basketball players. At the higher level, they don't have a lot of breaks, right? They have to play a game fully, and the games can last for hours, and they can't go to the restroom. So for them, what they end up doing is holding their pee. And so women who, that's the reason why, like, I don't know if you've ever heard your parents or your mom telling you or someone older telling you that you shouldn't hover over the toilet, that you should always sit down. And the reason why is because if you're hovering over a toilet, you're forcing your muscles to react in a way where it's not completely relaxed. And so you create this new habit, and your body thinks it's normal now. And so when you actually try to relax the muscle, you can't, because you also force it to slightly open. So when you sit on a toilet and you really relax, then you're able to, for your body to function. So basketball players, female basketball players, because they're forcing their bodies to hold and tighten up, they end up having pelvic floor dysfunction. So, and for them, it might not be a weakness. It could be urgency. So incontinence is when you can't your pee because there's some weakness. But incontinence can also be, caused from like how can you say, like the muscle's so strong because you've always had that now it can't fully relax. And because it's so tight and your bladder's full, it causes an urgency. Like you really have to go to the restroom, like you are having a rush. And imagine like something so tight and so full, it'll leak a little bit, right? Because there's too much in there. And so that's a reason why younger women can have incontinence. For older women in, past their 50s who've never had kids before, because their hormones are changing, their tissue starts to thin out, and that can also cause incontinence. If you talk to like grandma or mom, they will tell you like, yeah, I can't hold my pee, or I can't laugh, or I can't run anymore, things like that. And for them, it's because as you age, your muscles do become weaker, but our whole body becomes weak. But you can still change that. Like I have women who are going through menopause, who I've helped strengthen that area. They may not get full capacity of like strength there, but they can still do things like laugh, or they can still do exercise, because some of them, they stopped exercising, and as we age, we don't lose weight fast anymore. Our metabolism starts to slow down, and once you stop exercising, you start gaining more, you become unhappy, you don't want to go out anymore. And that's what I was experiencing with those patients. They stopped hanging out with friends because they always had to wear a pad. And the other thing is, you shouldn't be wearing a pad if you have incontinence, because pads are not made to hold urine. And if you're wearing it all the time, that can cause infections too. You'll end up having, urine, because, urine has a bunch of bacteria and stuff like that your body's trying to excrete. And if it's sitting on a pad and you're wearing it all day long, then that can cause a lot of other, things that can happen there. So if you're older and you have incontinence, make sure that you wear a proper pad that's only made for incontinence. And then again, like for those women, I would work on strengthening, and they may But see, if they had it for 20 years, it's not going to be as easy as me giving them like 8 different exercises and I progress them to become stronger. For them, I might also suggest getting like a device. It's like a biofeedback device. There's one out in the market right now that I really like because there's an app that you can connect to your phone and you can look at your progression and progress on the app. It's called the Elvie, which is spelled Elvie. And you basically use it when you have gotten to the point where, I mean, if I start with exercises first and I still can't get any progress, then I usually will suggest the LV. For some insurance company, they'll cover it. If they know that you do have an issue, we can get it covered, but just by a letter that's sent to the doctor, or not the doctor, the insurance company.
Oh, cool. Great. And then tell us a little bit. So we talked a little bit about urgency. And then another thing you wanted to talk about was retention. So tell me a little bit about those.
So retention can be related to urgency when it comes to urine or bowel movements. So retention is like that hypertonicity of your muscles. So your muscles are just hyperactive. They're constantly so if you think about the pelvic floor muscle, it's like our diaphragm. At rest, it's like a slight dome. And when you are using it to relax, then it inverts itself, right? But if you have hypertonicity because you've always held your pee or you've done other repetitive stress to that area, then that means that it's not a slight dome anymore. It's like a high dome. And when you try to relax that, you can't. And so some women are having issues with going to the restroom. They're very constipated, even though they've changed their diet, they've drank a lot of water, they're having fiber, all those changes, and they're still having a lot of constipation. That's retention. And then that can also happen with women who've had endometriosis because of all the scar tissue and the uterus. It tightens everything and pulls everything up. And they may have, retention and issues. But I've noticed that like you can have weakness and you can also have hypertonicity. So there's a few women who come in who have a weakness of the pelvic floor muscle, but they also have constipation and a lot of retention. And it's through years of habit, like what they're doing, like how they're holding their pee or hovering over their toilets. But then they've had a baby. So there's some weaknesses in some parts and then there's a lot of tension in another part.
So what I'm hearing is don't hold your pee. Because that'll cause problems. And then also, if you're a woman, don't hover over the toilet because that can cause problems too. Okay, so those are some good preventive things. And then what about pain during intercourse for women?
That is, so if you've just given birth, then it's sensitive, and it's also like an emotional thing, right? Like you just gave birth to a baby, and then you want to be intimate with your husband or your partners, and it's like you just can't, and it could be a mental thing, which I will also suggest them seeing like a therapist, like a family therapist. I think it's family and marriage therapist, or and they will usually do like sex therapy, and so they can kind of talk to both partners and like you ease into it. And then there's also prolapses that can cause pain during intercourse. So if you have a prolapse, it means that either your uterus is falling into the vaginal canal, or you have your bladder that falls into the vaginal canal or the rectum. And that happens because your vaginal walls have weakened. And that's still strengthening too. Like we can still strengthen that. And the best way to strengthen that is with the LV machine, because we have to think of our pelvic floor muscle as layers of muscles. And most of the times when people are working and strengthening that, we're only working outside. And so we want to work all 3 layers. And so the LV device is like the best way to do that. But a prolapse, if you think of it like with penetration, if something's falling into vaginal canal, the canal that you penetrate through, it's going to cause pain because you're hitting an organ. And so when someone complains of pain during intercourse, I have them go to a pelvic floor therapist that does internal work. So I know how to do internal work, but I don't do it often enough. So I'd rather them go out and talk to another doctor who's able to do that. But they can check to see how bad the prolapse is. Like if it's a prolapse grade 4, then there's really nothing holding it together anymore. So an organ's just going to fall and cover that spot. With that one, you may have to have surgery. And where they put a sling and they hold it up, or you can wear something called a pessary. And a pessary is just like a device. It kind of looks like the Diva cups. So when you wear a Diva cup, it's basically pushing everything up towards the uterus, and it makes everything stronger. So the canal is open, and with the pessary, you insert it in there. You have to get it medically size. So you have to see your doctor. They have to fit you for the right size. And then you put it in, you take it out and clean it once in a while. And then that will help somebody who has like a grade 3 and 4 prolapse. Grade 1 and 2 is most women. Whether, you've had 1 or 2 or 3 babies, you'll at least be in 1 or 2. And what we're trying to do is prevent it from getting to 3 and 4. Because once it gets to that point, it's so much harder to get back.
Okay. So in terms of, the machine, someone was asking, so it's Elvie, Elvie. Is that what it is? Okay. And then there's an app that attaches to that. And so that can be very helpful for all of the issues, it sounds like, that you've talked about today.
Oh yeah. And it's just a great way to see your progress. Because when you start at a baseline and it tells you how strong you are. And then you work towards, it's like a game. So they have different games on there. You start off with how hard can you hold? And then it'll have a game where you're holding and releasing and you're doing other stuff. Like you have to move this ball. And then it records like how long you can move that ball for and how hard you can move it for and how fast you can do it. And so it's just a great device.
Yeah, cool. Someone's asking about vaginal dryness and using estrogen. It's not necessarily something we're talking about today, but definitely some of this can be related to hormonal dysfunction, some of what we're talking about. From more of my perspective, from a naturopathic perspective. So what I would usually do is check the hormones and see if anything's going on there in terms of vaginal dryness and other menopausal type issues. Things like estrogen can be helpful. I usually like to use herbs before doing any kind of hormones. And if I am going to do hormones, I'm going to do bioidentical hormones because those are going to be, the safest to use. There was something else I wanted to mention in addition to that, and I'm forgetting what I wanted to mention there. But the other thing that you mentioned, which I think is a really important thing to point out, is the emotional part of it. And I think that that can be huge when I've seen people with pelvic pain or pain during intercourse or some of these issues, that it actually can be very mental, emotional, and trauma driven. So I like to do something called emotion code, which I do in my practice, but also there's a great book written by the person who created emotion code, and it's called Emotion Code. So it's something that everyone can read. And, if you're having any of these issues and you want to just uncover whether there is a emotional or trauma-based root cause, then I think Emotion Code is a great place to start too. Great. So it kind of sounds to me like every woman, no matter what age, whether you've had a baby, whether you haven't, etc., should be doing some of these exercises that you went into detail about earlier. And so would you say that that's true? I mean, like every woman, even like if you're not pregnant, if you're planning to be pregnant, if you've had a baby, it kind of sounds like every woman should be doing some kind of this blueberry Kegel exercise that you're talking about.
Yeah. It's, yes, before you get to, but then, you also have to think about, making sure that you don't put yourself in the other positions where it's retention. Because if you're doing these Kegels and blueberries and you already have a lot of hypertension, then you're just going to make it worse.
Okay.
So I would say yes, for most women, it's good to strengthen pelvic floor muscles. If you don't have any of the other symptoms, like you don't have urgency, you don't have retention, then it's okay to do those. It's just like any other part of your body. You want to make sure that you just keep it strong a little bit, right? Whether you don't have to go and lift heavy weights, but just doing Pilates or yoga, that helps to strengthen your muscles. And your pelvic floor is another part of your muscles, so you want to make sure that you strengthen it further, right? Because as we age, our bodies just becomes a little bit weaker, and we need to keep it and maintain our strength so that we are able to do the normal things that we want to do, like getting out of the car, or walking, because that all starts to change as we age. But
and then the whole blueberry thing, by not squeezing too hard when you do that Kegel is probably helpful to not create too much like muscle there.
When you're trying to rehab.
Yeah. Okay.
When you're starting off, then you start with the blueberries, but eventually you will be doing much stronger, harder holds. But when you've never done before, you want to start with the proper way, which is just the blueberries, because when we're doing this, we're also activating our core, and we don't want our core to overtake. We want it to work together, and that's the reason why we do it so slow.
Okay. Great. Well, is there any other kind of last words of wisdom about women's pelvic health that you want to tell our listeners today?
That it's never too late. It just takes a little bit of time, and anyone can do this. Like, don't feel that you've had 4 kids already, or like you're already in your 70s and you can't do it, because you can, and it works, and you just have to be dedicated.
Okay, great. And then Dr. Mendoza, where can we find you? Where do you practice? How can people find you and reach out to you if they want to do some of this pelvic work with you?
So I'm located in San Mateo, and you can just contact me by emailing me at drnara@befreelivewell.com.
Okay, great. And then that's also your website, right? befreelivewell.com. Okay, great. Well, I think this is a great topic. I think one that people don't often talk about. I think doctors definitely don't talk about or mention. And then we will be talking in about 2 weeks about men's pelvic health. Can you tell us a little bit about what we're going to be talking about then?
Yes. So I've had a lot of male patients come in with pain in their testicles, or pain after ejaculation, or they have a lot of pubic pain and they can't explain it. They've gone to the urologist, they've gone to doctors, and all the testings come out normal, and they're still having the pain. So we'll go over how to manage that, and what to do next, and who to seek out for help if you're having those types of pain.
Okay, great. All right. Well, I look forward to our chat in 2 weeks, and I hope you guys will join us, or if your husband or your partner or your friend has any of those problems, make sure to have them tune in with us in about 2 weeks. All right. All right. Dr. Mendoza, have a great rest of your day. And everyone, thanks for joining us today on our IG Live.
Bye.
Bye.